Hi, welcome to the Lymphedema Guide. My name is Matthew Lacey. I am an occupational therapist and a certified lymphedema therapist working in Central Arkansas. Today is the first video installment in our lymphedema channel. It's basically an educational resource for people that are dealing with lymphedema. Today's topic is starting at the top. What is lymphedema? To address that, I'm going to start by doing a little bit of a dive into what is the lymphatic system. To start, the lymphatic system is a dual function part of our body that is in control of our immune function and fluid removal, and it also analyzes the fluids in our body. To start with the immune side of it, we have all heard of lymph nodes. We have them up around our head and neck. People report that they swell whenever we have a bad head cold, something like that. Your lymph nodes are what produce lymphocytes, or white blood cells that go out and fight infections in our body. So we have lymph nodes in different parts of our body. We have head and neck, which we talked about just a second ago, under our armpits, in our abdomen, around our colon, more specifically. We have them in our groin creases, basically where your hip hinges, and behind your knees. These are the big concentrations. These lymph nodes produce white blood cells that fight regional infections, so that if I cut my hand and I get a minor infection in my hand, the lymph nodes in my armpit produce lymphocytes that go down and make sure that doesn't become an issue. The other side to the lymphatic system is the fluid removal aspect. And this is more what we're getting into with lymphedema, though both are very, very important aspects. With the fluid removal side, we have lymph vessels. So if you imagine my arm is covered with a spider web of very, very small lymphatic vessels. And these vessels are in charge of removing fluid from our tissues that accumulate there. And when I say tissues, I just mean like all the empty space between our cells. And we are full of empty space. Our bodies are like a sponge. So all those little tiny holes in that sponge that hold water are essentially the interstitial space, and that is the space between our cells. Fluid collects there because of blood flow. So when we have blood flowing through an area of our body, and the tissues that are there get nourished by that blood, and the blood is returned through the veins, there's a little bit of water and protein that is lost out into the empty space. That is a very normal part of daily life. What happens when we have lymphedema is the lymphatic system can no longer remove that fluid from that empty space like it needs to. What results is swelling, and that is where we're getting to with what is lymphedema. So we've got the lymph nodes and the lymph vessels working together to both produce white blood cells that help us fight infections, but also the lymphatic vessels removing that fluid from the area. The lymph nodes also act like a checkpoint for the lymphatic vessels. So my lymphatic vessels in my arm remove fluid, they travel up through my arm, they go to the lymph nodes in my armpit. There, that fluid is analyzed for anything bad that might be in the makeup. So cancer cells, infection, it's analyzed and it proceeds on through deeper and deeper lymphatics and veins. It does connect to the veins at the lymph nodes until that fluid goes back into the blood, where it's sent out through your heart and kidneys, filters off. What comes out when you go to the bathroom is waste. What gets recycled is recycled. So with the lymphatic system, lymphedema comes up when the lymphatic system cannot function efficiently. And this is due to a multitude of factors. And we're going to see a 30,000 foot view of it today. With lymphedema, there are two types of lymphedema. You have primary and secondary lymphedema. Primary lymphedema just means hereditary lymphedema. A person is born with innate factors that cause their lymphatic system to not function effectively. And when I look at it as a practitioner, I like to think of this more as a vessel issue. So the lymphatic vessels didn't form properly at birth. Therefore, the system is inefficient and it's having trouble removing fluid from an area. It can affect anywhere in the body. Typically, we see it in our extremities, and most commonly the legs. That is because of gravity. Gravity is the arch nemesis to lymphatic function. So when gravity is pulling on these fluids in our body, everything wants to settle at the lowest point. Human beings are upright creatures. We live on our feet, we work on our feet. We're upright when we do anything. So gravity is always working against us toward our feet. Primary lymphedema can affect people across the age spectrum. Babies are born, freshly newborn, with a swollen limb sometimes. It can manifest after puberty with the hormonal changes that go on during puberty. You can see early adulthood, 25 to 35 years of age. A lot of times women during pregnancy and after childbirth will see this as an exacerbating event, after which they have trouble with swelling in their leg. And this is specifically for clients with hereditary forms of lymphedema. Hereditary lymphedema can also affect people late in life. You may never have seen really evident signs and symptoms until a total knee replacement at the ripe old age of 70 years old. The knee replacement can cause a little bit of trauma to the area that can spark postoperative edema, and that can be the overload that the lymphatic system needs to end up showing signs and symptoms. So I say all that to really hit on the fact that it's not a certain age bracket that we have to see this manifest. Hereditary lymphedema can manifest at any point in a person's life. And the fact that it's hereditary doesn't mean that you have to have a long family history of swelling. You can be the first person in your family to show these signs. The second part to lymphedema is secondary lymphedema. Secondary lymphedema is any type of lymphedema that's caused by a factor other than the lymphatics not being formed correctly at birth. Examples of this are too numerous to hit in one video, and that's actually where we're going to go with other videos, is diving into each of these areas of healthcare and just diagnoses that can cause lymphedema eventually. But commonly we see breast cancer related lymphedema. A patient has lymph nodes removed as part of that cancer treatment process. They are trying to prevent the spread of cancer. Having lymph nodes removed is like taking out a piece of the plumbing. So you've now limited the amount of pathways that this lymphatic fluid can travel through the body. Therefore, we can see traffic back up. We see swelling as a result. Another way in which we see secondary lymphedema is with trauma. Car accident, for example. I hurt my leg badly, a crush injury damages my lymphatics, and I have trouble with swelling from then on. It is an unfortunate thing, but trauma in those ways can cause lymphedema. And then thirdly, we see vascular issues, peripheral vascular disease, venous return issues. All of these affect how quickly blood can flow through an area. And when blood cannot flow efficiently through a part of the body, pressures increase in those vessels, and it pushes off more of that water and protein into the empty spaces of the body, in which case we start to see more of a load being placed on the lymphatic system, and swelling occurs. When lymphatic load exceeds its transport capacity, that's just the amount of fluid that a lymph vessel can transport over a given amount of time, that's when we start seeing swelling. And when it happens on and on and on every day for you name it, we can see damage done to the lymphatics, and then it becomes lymphedema. Swelling at the end of a day, being on my feet a lot, eating a bunch of salty foods, and my ankles get a little puffy, flying overseas, 10 hours on a plane, my ankles are going to swell a little bit. I don't have lymphedema, but it is overload on the lymphatics short term. We're going to get into that later, but it doesn't mean you have lymphedema just because you have some swelling. When we want to call this lymphedema is when we're seeing it be a chronic issue where elevation and exercise are minimally effective. And even that is a stretch, because I like to think of it, and I like to describe it to my clients. If you're seeing signs of swelling and it is an ongoing, everyday thing, that at 5 o'clock you get off work and you have lots of swelling in your feet and ankles, this is a perfect time to start looking for help for this. It doesn't mean it's too early. It's never too early to start looking for the right pathway to go down in order to keep this thing from getting worse. Too often we see clients come into our office that have a 30-year history of lymphedema. They have never known where to go to get help. They've never sought help. There's a lot of things that can go on that cause a person to not seek assistance. But the longer something like this goes, the more difficult it is typically to treat and have good success. Now, I want to say also, it's never too late to seek treatment, because we have those 30-year history clients that come in and we make incredible progress with them. So it's never too early or too late, but I say when you see signs of stubborn, chronic swelling, seek help. First stop is always your physician. See the people that are working with you on your regular basis healthcare needs. Talk to them. See what could be causing this. See, where do I go for treatment? Another way that you can go about looking for help with this is online. So search for lymphedema therapists in your area. When something just like a simple Google search doesn't work, there is an organization called the Lymphology Association of North America. It's a mouthful, but it's LANA for short. And we're going to go to their website, and we're going to type in cltlana.org into our search bar. And I'm going to pin a hyperlink in the description below the video so you can go directly to their website. But you go there, you can plug in your zip code. It's going to pop up a map and show you a list view of all the lymphedema therapists that are registered with the Lymphology Association of North America. This is not the only way to find a certified lymphedema therapist, or CLT is how you'll see it described on their credentials. But it is a good way to find somebody in your area that you can know practices lymphedema, is knowledgeable. With that search, find somebody close to you. And even if you are a 2-hour drive away from a lymphedema therapist and you're having a lot of concerns and questions, go see them. You may not be able to follow up with regular therapy sessions, but you can at least go and talk to somebody who knows about this thing. They can look at your situation, your health. They can make a plan for you. You can discuss barriers and benefits of treatment. Get into the details with the person working with you. And even if it's a one-off education session, it is worth so much to just have that knowledge and peace of mind. So go visit with a lymphedema therapist. And that's essentially all we have for today's video. We're going to be doing a lot more topics where I'm going to be bringing in colleagues of different disciplines, but also some therapy coworkers and friends of mine that specialize in different areas and have a passion in a specific area of lymphedema. We're hoping to do some talks on breast cancer related lymphedema, pre-op, post-op, different types of managing strategies, wound care. There's a lot of different topics we're going to start covering, and this is just the tip of the iceberg. So I hope that you will subscribe, get the notifications for this channel, and share this with any family, friends, healthcare providers that might find this interesting or helpful. And we will see you next time. Thank you. Bye.